Hello everyone, welcome to week number 3. So this week we only have one chapter we are focusing on, and that is going to be chapter 39, which is assisting with eye and ear care. So this week we get to look at the fun stuff. So let's take a closer look at that chapter. So chapter 39 is going to discuss eye and ear care. So I really want to start at the top. I'm going to start with your eyes. And I want to talk about the study of your eyes and the care of your eyes. So the branch of medicine that really deals with the structure, function, diseases of the eye are all called ophthalmology. An ophthalmologist is a medical doctor who can perform exams, surgeries, but they can also prescribe medications or glasses and contacts. An optometrist is really the technician who specializes in the grinding of lenses and the preparing of glasses and contacts. So try not to get those two confused. The ophthalmologist is actually the individual who is the provider who takes care of the eyes. There are a number of types of exams that can be used to diagnose and treat vision problems. Most of these can happen in a primary care office during such routine exams, but when you're doing a vision exam, the provider will look at the patient's pupils as well as the eye as a whole. So there is an approved acronym that we use for eye exams, and that is called PERLA, P-E-R-R-L-A. And what that means is pupils equal, round, reactive to light, and accommodations. So anytime you see that in a patient's chart, know that it is referring to the eyes and the pupils. There are some other abbreviations that we also use for the eyes, such as OD, which is right eye, OS, which is left eye, and OU, which is both eyes. So when you're doing some exams, you may need to say what the vision is for the right eye, the vision is for the left eye, and the vision is for both eyes. So you can use those abbreviations. When you're doing exams, medical assistants or providers will test visual acuity or the clarity of vision. Now, normal acuity is 20/20, but not everybody has 20/20 vision. As a medical assistant, you will be responsible for assessing visual acuity, such as distance acuity, near vision acuity, or color vision acuity. So let's take a closer look at what each of those mean and the types of testings that you'll be performing. So when you're doing distance acuity, we use a method called the Snellen chart to examine this. The chart places large symbols on the top line, and then each line coming down from that gets smaller in size. A patient will stand about 20 feet away. If they're an adult, if they're a child, they're going to stand about 10 feet away, and they're going to read each line, starting from the top, working down. They'll do this with their right eye, their left eye, then both eyes. If your patient wears glasses or contacts, you'll have them do it with the contacts or glasses and then without. The result that the patient receives is the last line that they can read without any squinting or mistakes. And it'll be read as a fraction. So when you look at the side of a Snellen chart, it will have things such as 20/20, 20/40, 20/15, 20/30, 20/50, and so on. What this means, for example, let's start with the 20/30. It means that the patient can read at 20 feet what other people can read at 30 feet. So not really great vision. Near vision acuity is done when patients really have a problem reading or performing tasks up close. When we do this type of testing, it's done with a Jaeger chart. And what that is a small card, and we have the patient hold it at a normal reading level, which is generally 14 to 16 inches away from their face. And the card has a series of paragraphs on it that the patient will read out loud. And just like the Snellen chart, they start big and then they gradually get smaller. The patient will read each paragraph until they can no longer read, or they can no longer read without struggling. And the patient's result will be the number that is above the paragraph that they can read easily. And the last one, the color vision test. This is really a test that is done when you are unable to distinctly differentiate between colors of a spectrum. Defects in color vision are both from birth, you're born with them, they're inherited, or you acquire them through a disease. Most of the time, men are going to be the patients who will have color vision problems or color blindness. When you're performing a color vision test, you will use a test called the Ishihara test. This is a printed cards in a book or in a single color form. And what you're going to have is a color dot illusion containing a number or curved lines or shapes. And what you're going to do is you're going to show the patient 14 cards. They must identify 10 of them correctly in order to be considered normal color vision. Alright, so that's kind of the discussion on the eye that I want to do. Let's kind of switch gears. Let's talk about the ears for a minute. So the study of hearing is known as audiology, and the providers working and specializing in the ear are called an audiologist. Now, our ears are pretty interesting organs. They're not just used for hearing, they're also used for balance. So most parts of your ear are really kind of the internal parts, and they're protected by the temporal bone of the skull. And the instruments that we use to examine your ears are called an otoscope, a tuning fork, and an odometer. The otoscope is a lighted instrument used to examine your tympanic membrane. A tuning fork is a metal object that looks very much like a fork, and it produces a vibration when it's struck. So you're going to strike that, so the vibrating instrument will then be placed near the ear or placed on the top of the head or on the forehead to give a rough hearing assessment. You want to see if the patient can actually hear that vibrating tone. And an odometer is an electronic instrument that measures more frequencies, or the number of fluctuations per second of energy in the form of sound waves. Most of us had to do this when we went to go get our licenses. They put the earmuffs on and they say, okay, raise your hand when you can hear this tone. And what side do you hear it on? When the patient indicates their ability to hear that sound, a recording is made on the audiogram. So that's what we kind of will look off of, and the providers will make their decisions and diagnoses off. So now that we understand that hearing test and how those are performed, there are a few more items that a medical assistant are responsible for. We're responsible for things such as ear irrigations and installing ear medications. So either time that you're doing an ear irrigation or an installation of a medicine, just like the eye, there are some abbreviations that we do use. Those abbreviations are AD for right ear, AS for left ear, and AU for both ears. So when you're doing an ear irrigation, it's necessary to remove the impacted earwax serum. So that's why we do those. Patients come in and they're dizzy, or they're having trouble hearing. Generally, that's from an earwax buildup, and medical assistants are responsible for removing that. So you'll use warm water and a syringe that we then insert into the patient's ear and slowly push that the water in, so it will push the earwax out. You'll need to access the patient's ear canal during this process, and this is done by pulling on the ear. Now, if you have a child who is under the age of 3, you're going to take their earlobe, pull it down and to the back, For adults who are 3 and older, you're going to take the top of the ear, pull it up and to the back. Okay? When you're installing an ear medication, we do this when the patient either needs help understanding how to do an eardrop, or we are doing the eardrops for them in the clinic. So you will have the patient either tilt their head away from, you want them to tilt their head away from the affected ear. Okay? You can have them lay down as well, whatever they're more comfortable with. And again, you're going to pull that earlobe to access the ear canal. Then what you'll do is you'll take the dropper, and you want to avoid actually touching that to the ear canal itself. You want to actually hang it right above. And then you're going to place in the appropriate amount of drops that were ordered by the provider. The patient will need to stay like this for about 3 to 5 minutes just to make sure that that medication can work itself into the ear correctly. Alright guys, so that is kind of the brief overview that I have for all of you on Chapter 39. As always, please make sure that you read your chapter in full, as there are some things I did not talk about that will be necessary for you to know. This week, you do have one discussion post, and that is on disorders of the sensory system. You'll need to pick 2 diseases or disorders that affect the eye and the ear. You need to choose one for the eye, one for the ear. Okay? And then you're going to explain those signs and symptoms that are related to the disease, the cause of the disease, and the treatment of the disease or disorder you chose. You'll need to make your initial discussion post Tuesday by midnight, and your 2 classmate responses will be due Saturday by midnight. Also this week, you have another quiz. Remember, there's going to be a lot of them this quarter. This quiz is solely based on Chapter 39, so eye and ear exams, and the testings that we're going to be doing. It is a 10 multiple choice questions with a 10-minute time limit. As always, we'll be doing a quiz review prior to, so make sure you come prepared. And this quiz is an online quiz, and it will be due Sunday by midnight. And lastly for this week, you do have one written assignment. This assignment is about the visual acuity testing and the importance of the testing. So there are a few questions that you will need to answer while you're writing this paper. Those can be found in your written assignment agenda for this week. So please make sure you're looking on Angel to make sure you answer all those questions correctly. Keep in mind that this assignment also needs to be a 2-page written paper in APA format. And your written assignment is due Sunday by midnight. Alright guys, that is all I have for you. Have a wonderful week, and I'll see you on Tuesday. Bye now.